Colleagues and students, we are entering into a pivotal time across our nation and across our college in relation to the COVID-19 pandemic. While state leaders make challenging decisions to reopen and to do so safely, the College of Medicine faces similar decisions on a different scale. There is a great deal of planning ahead of us. We have become accustomed to uncertainty. The college has repeatedly shifted and adapted to the changes around us during the last couple of months. We have accomplished in a matter of weeks things that would have taken us months to do in the past. To name just a few, we shifted curriculum almost entirely online. Much of our workforce was moved to remote status while adjusting and remaining efficient. We graduated 193 of our M4 students a month early to send them out into a potentially taxed healthcare system. And we celebrated commencement for the entire college virtually through a YouTube live stream. In addition, we have conducted town halls with students, faculty, and staff, hearing their concerns and doing our very best to answer their questions. To put it bluntly, we've gotten quite a bit of stuff done, and we've gotten it done quickly and done well. For that, I'm proud of all of you for your patience, resiliency, and your commitment to fulfilling the college's mission. We now must turn to the recovery of our college. This recovery process will be even more complex and challenging than our initial responses to the pandemic. As we look at the three pillars of our mission, education, research, and clinical care, we must focus on how we begin our recovery in these areas in ways that are first and foremost safe, but also meaningful and impactful. Certainly, we cannot declare victory over COVID-19 or this pandemic, and we realize that the college's efforts happen while there are many patients, some of them in our own healthcare system, who are still fighting for their lives and looking to their own recovery. Our foremost concern is safety for our college community. The essential work that can be performed remotely by our dedicated faculty, staff, and students will continue to use telecommuting, telehealth, and online learning technology whenever possible. For those who will be on our campus, the college is committed to providing personal protective equipment, appropriate social distancing, and a clean working environment for all. Our research enterprise has not closed, but ongoing work, of course, is focused on coronavirus research and other essential research areas. Discussions around further ramping up research activities have been taking place. Again, the plans to accelerate research discovery focus on how we can do this important work while maintaining the safety of our researchers. The Vice Chancellor for Research and the Vice Chancellor for Administrative Services have been wonderful partners with our college as we attempt to identify the timelines and milestones for our research programs. The college's clinical care activities are also growing. The college is working closely with our other UI Health partners and Huron Consulting to coordinate the recovery of the clinical enterprise. Non-urgent but medically necessary time-sensitive surgeries and procedures have already resumed and will be scheduled based on patient need and available resources, which are determined daily. Work to increase the number of patients that can be safely seen in our ambulatory clinics is well underway, and a concerted plan to allow us to begin to once again routinely care for children within our inpatient facilities is being developed. Our medical education group has crafted a detailed recovery plan. Through the summer, the didactic elements of our curriculum will continue to be delivered remotely. However, we're looking forward to the return of our students who are engaged in clinical clerkships, with the first cohort of students in Urbana planning to return to clinical rotations this week, followed by students in Rockford, Peoria, and Chicago in early June. The start of these clinical activities will need to be tailored to the realities of the coronavirus pandemic and the readiness of our clinical affiliates to teach our students safely. The administration of critical licensing exams to our students has begun in Illinois, including at our own testing site in Rockford. Nationwide, students will face new limitations on external clinical rotations, new virtual interviews for residencies, and new timelines for residency application and matching. Our college is preparing in earnest to support our students as they adapt to these changes. A great deal of decision-making and change lies ahead for the college, and it will take all of us, faculty, students, and staff, working together to implement change and to do so in a way that's safe and meaningful. Considering the collective dedication to our mission, spirit of collegiality, and amazing talent embodied by all of you in our college, I have no doubt that we will be successful in these efforts. As always, please be safe and be healthy.